I'm Roseanne. I'm the nurse here. I had an ultrasound picture of your baby, and I know you had some questions about that.
All of my friends are telling me to have an abortion. That is not actually a baby yet.
It's just a blob of tissue or something? Actually, right at the time of conception, and do you know what I mean by conception? When the sperm and the egg meet, right at that time, there's a new DNA there for this unique little human being. It's not your DNA, it's not your partner's DNA, it's a new DNA. It implants in the lining of the uterus. The baby is receiving nutrients, and that's where the baby grows. At about 18 days to 21 days, so say 3 weeks after you've conceived, there's already a heartbeat there. Weeks, everything is in place. Nervous system, the brain waves are functioning. It goes from being called an embryo to a fetus at that time, and that means in Latin little offspring or little one. I know when you came in here today, Callie, your thought was maybe abortion. What do you know about the abortion procedure?
All I know about the abortion procedure is that it only takes a little while, and you just go into a clinic and it's over and done with quickly.
I've sat down with a lot of gals that have told me the same things. Some places even treat it like it's, like no big deal. And they don't even explain a lot of things to you and tell you exactly what's going to happen and the risks. The abortion procedures change according to how far along you are. The woman has a uterus, and at the end of the uterus is the cervix, and it's a very tight structure. And the reason it's tight like that is because it's to hold the fetus and the baby in there until it's time to be born. During an abortion procedure, what the doctor has to do is he has to dilate that cervix, because the only time the cervix is supposed to be dilated is when birth is happening. Insert a hard plastic tube into the uterus, and then a large syringe is attached to it, and a suction machine is used and just suctioned out parts of the baby. They call this products of conception that the doctor has taken out. Up to the point of 13 to 24 weeks, that is called dilatation and evacuation, or D&E. And this is done usually during the second trimester of pregnancy. At this point, the fetus is too large to be broken up by a suction machine. So they have to insert these rods called luminaries a day or two before the abortion. Once the cervix is dilated, then the fetus's head is brought out and delivered first, and the head is crushed. And then the rest of the baby is delivered. And it's a lifetime decision. This is basically a blind procedure that the doctor's doing, and he could perforate the uterus, scar it. And there, have been reports of deaths also from different complications of the abortion.
Hi, Callie. Nice to see you. Come on in. I'm Jennifer.
Nice to meet you.
Well, Callie, I just wanted to share with you some of the possible psychological effects of abortion that some women experience afterwards. Some women have no side effects that they report, but there are many other women that have reported up to 100 different types of psychological complications. Depression, loss of self-esteem, self-destructive behavior, suicidal tendencies, sleep disorder, memory loss, chronic problems with relationships, dramatic personality changes, anxiety attacks, guilt, remorse, flashbacks, increased tendency towards violence, chronic crying, difficulty concentrating, loss of interest in previously enjoyed activities or people, and sometimes difficulty bonding with children. Sexual dysfunction, it can be of a short or long duration. It may include one or more of the following: loss of pleasure from intercourse, increased pain, an aversion to sex or males in general, or the development of a promiscuous lifestyle. Women are more likely to commit suicide in the year after an abortion. If they had given birth, those women are less likely to commit suicide. Women who abort are more likely in the year after the abortion to die from homicide or die from an accident as well.
Is there any positive psychological side effects to having an abortion?
Some women do report one positive emotion, and that is relief, which is understandable because so many women feel pressure just to get it over with. Really the only choices women have once they're pregnant is, are they going to carry that baby and make an adoption plan? Are they going to carry that baby and parent? Or are they going to terminate the pregnancy? America has the most liberal abortion laws in the entire world. America has abortion legal through all 9 months of pregnancy, whereas other countries have restrictions on the amount of time can pass before an abortion takes place. So it's not just about the baby. If it is a life-changing decision, abortion harms women. I really just want women to make sure that they are fully informed before they go through and make such an important decision in their life. So pregnancy resource centers there's about 1,000 pregnancy resource centers across the United States, and they really want to reach out and help women to make sure that they get an informed decision about their pregnancy options. And so we talk about parenting, we talk about adoption, and we give women accurate medical information about what abortion procedures are, what the physical side risks could be, and what the possible psychological side effects could be as well. Not only do we offer pregnancy tests, many of the pregnancy resource centers offer ultrasound to confirm a viable intrauterine pregnancy. Once they decide they're going to carry the baby, we offer baby items, diapers, wipes, toiletries, cribs, clothing, high chairs, strollers, things of that nature. We also have parenting classes to help them just become the best moms and dads that they can be. And a lot of pregnancy centers not only help women, but we also help the dads. And we really want to just make sure we're helping to build stronger families in the process.